Hello, my name is Sherise. Today we'll be discussing healthcare in Bolivia. We will be discussing healthcare access and equity, healthcare regulation and policy, also diseases, and what can we do to improve the health of Bolivians, and how do we work together to do that. Bolivia is located in South America. It has a very rugged terrain. It is located within the Andes Mountains. It has climates that range from very cold to very hot and humid. The population is a little over 11 million people, with 60% of the population represented by 37 recognized indigenous ethnic groups. Within these ethnic groups, they also have very different languages as well. We will discuss this a little bit later. The gross national income is $3,070. According to the World Bank, this places Bolivia in the lower middle income group. Healthcare access and equity. Geography and the dispersed population in Bolivia make it for a very remote and rural communities that lack healthcare services within the country. Also, poverty plays a very important role in healthcare access and equity. 60% of the population, about 5.3 million people, live in poverty. The rural and poor communities play to the fact that Bolivia has a high maternal mortality rate. Maternal health is somewhat of a crisis in Bolivia, though Bolivia has made great strides in reaching the Millennium Development Goals, such as reducing child mortality and also combating HIV and malaria. They have great strides to make in maternal health. Bolivia is a part of a pluralistic healthcare system. This includes public, which is regulated by the Ministry of Health and executes national health policies and strategies at a central level. They also have Social Security. Social Security is for salaried employees in the formal sector. That makes them eligible for this program. Private subsector involving profit and nonprofit are also present. Unfortunately, the high out-of-pocket expenses associated with the healthcare system in Bolivia are often a deterrent for the people. Healthcare regulation and policy is managed by 4 levels of organization in the government. National has responsibilities of strategy, standard setting, and policy. The departmental, their responsibilities include tertiary center healthcare services and also human resources. The local and municipal responsibilities include primary, secondary level health centers, also human resources and infrastructure and equipment and supplies. The United Family Community and Intercultural Health System was a major reform within Bolivia for healthcare. This included having a more intercultural, integrated healthcare system to be able to provide better care for the people of Bolivia. Disease. Communicable diseases such as diarrhea, lower respiratory, and other common infectious diseases have a mortality rate of 45.4%. These diseases are often treatable and preventable. The poor rural communities within Bolivia make it very hard for them to seek out services. They have the long distance to travel, and also the financial concerns of seeking out these services for their loved ones. Vector-borne diseases such as malaria and the Zika virus are a concern. Non-communicable diseases such as cardiovascular disease has 33.5% mortality rate. Maternal mortality, like I mentioned before, is a major health concern for the Bolivian people. They have great strides to make in that area of women's health. Unfortunately, there is cultural barriers to seeking out health care for women. The quality of care for pregnancy and childbirth is somewhat lacking. Unfortunately, Bolivia has a 37% maternal death rate in healthcare facilities, which is a major deterrent for women to give birth in these facilities. There's also cultural and social concerns for women. They have a fear and embarrassment related to receiving care in public health centers. They also worry about poor quality of care. The distance and the economic constraints also prevent from them seeking out these services. The perception that healthcare services are not necessary due to the thought that they are giving birth in an easy way. It's known as easy birth. Women, it could be a sign of weakness within the community. Recommendations and collaborations. I think language ambassadors is a simple and efficient way to provide women with information about the services available to them and what they can do to protect themselves in terms of healthcare education and policy that is in place to ensure their better health. Legislation for sexual and reproductive rights. This will help provide, funds and resources to help combat sexual health and reproductive health concerns without any barriers for them, or any thoughts of repercussions for whether that be they are a victim of a sexual crime or being gay or lesbian. Also expanding the My Health program. This is for rural communities in the most remote areas. This provides them with primary health care. Providers go house to house to provide these services to improve the overall outcomes of their communities. Building remote healthcare facilities for rural communities is a long-term goal, but very necessary because there are so many communities within Bolivia that are extremely remote, and making these services more available in these rural communities may definitely shorten the travel time and the out-of-pocket expense that it causes to take that travel. I hope you enjoyed listening to my presentation today, and I thank you and talk to you soon. Thanks. Bye-bye.